This is Doug Field and Brent Macy, your hosts for HealthCare Consumerism Radio, and welcome back. We're on our final segment, and we're pleased to have, throughout this show today, we've been talking about the private exchange market, and it's a nice segue to have our final segment end around the focus on one of the leading consultants in this industry, Mercer, and their launch of Mercer Marketplace. And joining us to discuss what they're doing with Mercer Marketplace is Eric Grossman, senior partner at Mercer. Eric, good morning.
Good morning. Thank you for having me.
Yeah, good to have you. You coming to us from Connecticut today?
I am in lovely and cold New York today.
Oh. I'll tell you, we're in lovely and cold Atlanta today. It's we had a little dusting of snow this morning, so it's not springtime in Atlanta yet. I think it's very interesting as we look at this space, Eric, to see all the major consulting companies finding or looking to find a foothold in the exchange marketplace. Tell us a little bit about what Mercer's doing with Mercer Marketplace and the uniqueness of what you guys are doing.
Sure. Well, first, we view the exchange marketplace as something that is going to grow very rapidly over the next few years. In fact, from our national employer survey middle of last year, 56% of the respondents said that they are going to consider providing benefits through an exchange over the next few years. My bet would be that percentage is increased today since we conducted that survey in the middle of 2012, and there's been far more intensity of interest paid to exchanges since then. So what Mercer has done is built an exchange that, in essence, offers one-stop shopping for both employers and employees. Mm-hmm. One place for an employer to go to offer all benefits coverage, complete administration and customer service solution, and all of the related employee communications around benefits. From the employer's perspective, we've also focused on that one-stop shopping. One place for a consumer or an employee to go where they could assess all of their insurance needs, whether those needs are health care, medical, dental, other of what's considered core benefits, life insurance, disability, and a full set of what commonly today are called voluntary benefits, whether they're supplemental health products all the way through auto and home insurance. So one place for a consumer to assess all of their needs and then purchase those coverages most cost effectively to meet their insurance needs.
Will you also see in your marketplace, will they have accessibility to some of the evolving decision support solutions like, transparency, et cetera?
So we are embedding a number of decision support tools for our members. Mm-hmm. We will have what we call guided shopping. Guided shopping is a very simple way through literally a handful of questions for people to indicate some basic characteristics about their needs and their risk characteristics, and that will enable us to tag various plans with a best match symbol. Mm-hmm. We actually think that most people will want to make decisions using that guided shopping, relatively simple, streamlined process. We will then have people who, want to look at all the gory detail 3 times before making a decision and drill down into quite a bit of, plan provision and carrier detail, and we will enable that as well. And finally, we know that we have a segment of participants that just want to talk to somebody who's going to, in essence, tell them what to do. Mm-hmm. And we will provide that type of decision support for people also.
So you'll have the call center.
Absolutely.
Yeah, I think that's so important. I think, that everything's made about the web, and certainly these marketplaces are going to make it far more efficiently. But I think you're so correct that at some point, some people just want to talk to somebody.
Yeah, these are really important purchasing decisions for people that involve significant sums of money and obviously some very important areas like health and life insurance. It's not like buying most things on the web. and we do expect that a fairly high percentage of people, at least initially, they're going to want to talk to somebody.
Eric, what's the benefit? If I'm an employer, what's some of the top 3 benefits that for me to move to an exchange platform like yours?
I think that's a great question, and I'll focus on 2 things from the employer's perspective. The first is that for many employers, benefits management has become overwhelming. There is an ever-increasing pace of regulation. The market is extremely fragmented and complex, and while they know that benefits are a necessary part of their employment value proposition, the management of those benefits often detracts from their ability to focus on more strategic workforce issues. What an exchange offers is simplification and standardization and frankly, moving a lot of that management responsibility to the exchange provider. And we're finding that's a very attractive feature for a lot of employers. Then, of course, there's the money. And exchanges are frequently associated with the concept of defined contribution, something we've all gotten very used to over the past 15 or 20 years in the retirement area. But there's tremendous interest right now in employers saying, I need to de-link how much I spend on benefits from the underlying cost of those benefits, mainly medical, because that's where most of the spending is. And instead of increasing our costs for medical with the 6 or 7 or 8% that medical costs go up every year, we need to limit it to a defined percentage. Maybe it's 2 or 3%. Now, a company could do that today. They don't need an exchange to do that. But if you just did defined contribution and nothing else, it's just a cost shift. Yeah. What an exchange will facilitate, what Mercer Marketplace in particular will facilitate, is helping people make better medical decisions. We know that the majority of people are overinsured for medical, and they're overinsured for a few reasons. One is we have the most powerful force in the universe being inertia. I've had this plan forever, so I'll keep it. The other thing we have is fear. I go out there with a $1,500 deductible plan, and for a lot of people, that's the end of the discussion. We know through evidence that through better decision support and through being able to tangibly address that fear, being able to tell that person what you're most afraid about with the $1,500 deductible is that you're going to wind up in the hospital. Well, you can buy a relatively low-cost hospital indemnity policy to supplement that medical plan and protect against your risk and cover your fear. And if we get people to buy down to less expensive medical, that makes the defined contribution not just a cost shift, but it shrinks the overall cost of the benefits program, helps the employer manage their defined contribution, and helps the employee make the best spending decision on that defined contribution that the employer gives them.
We're all going through
those 2 things, the complexity of benefits management and the move to defined contribution that are driving this.
I think that's very well said, Eric. We're all going through behavior change right now. The whole food chain is. And to your point, everyone understands defined contribution because there's been a lot of success in the retirement plan market with the defined contribution model. But you're actually stating that your Mercer Marketplace becomes the behavioral change solutions for the employee without burdening the HR and benefit department.
Absolutely. If we don't get behavior change, it's just a cost shift.
Yeah.
Is there a role? You had mentioned the guided shopping. A lot of the general agencies and other broker groups out there, and I know you guys are a leading consultant group. Is there a role for the general agents out there within these exchanges? Do you see a role for them? Maybe not only in yours, but in other exchanges.
Well, so Mercer Marketplace is a proprietary exchange to Mercer and related Marsh & McLennan, our parent company, sibling companies. But we do know that there are brokerages and agencies out there on a local or regional basis that have partnered with either insurers or technology companies to be able to offer an exchange.
Eric, what's Mercer Marketplace is sweet spot? What employee size are you targeting right now?
100 and up.
100 up. Okay, good.
And both insured and self-insured employees, and a lot of times exchanges have been associated with a requirement for fully insured coverage.
Right.
For employers at 800, 1,000 lives or up who are self-insured today, we see no value proposition in those companies moving to an insured basis where apples to apples, that's probably going to add 5% to cost at the same time when you're trying to decrease cost.
Yeah. We got about a minute to go here on the program. Time flies when we're having fun, and we do hope we see you in Atlanta. I know that Mercer's going to be participating with us at our Forum East.
One of my colleagues will be there, in fact. We're looking forward to it.
Yeah, I look forward to seeing you too. Give us kind of a final takeaway from Mercer as it relates to your marketplace.
So again, thank you for inviting me. I appreciate your time and everybody's time on the phone. I would say the key takeaways are the delivery of benefits is going to fundamentally change over the next couple of years. Exchanges are going to be a mainstay of the landscape. We believe an exchange that enables that one-stop shopping for both the employer and the employee, and in a tangible way facilitates that move to defined contribution, is going to work really well both from the employer's perspective and the employee's perspective. And we look forward and encourage everybody to learn more about exchanges in general and Mercer Marketplace.
Thank you, Eric, very much. Enjoy your weekend up there, and we'll see you soon. And to our audience, join us next week on HealthCare Consumerism Radio at 11 o'clock.